Hello! On today's show, we'll be finding out the current trends in sickle cell management, what the doctors are doing these days to ensure that sickle cell patients live a long, fulfilling life. Imagine not sleeping properly for one night. How grumpy you will be. We'll meet a lady, Victoria. She hasn't had a proper sleep for 2 years. Not 2 nights, not 2 months, 2 years, all because of pain in her abdomen. Dr. KK will be telling us an interesting history about the University of Ghana Medical School. This show is brought to you by Vodafone. Further together.
So that mom can be able to open the door. This is it.
Please open the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Here, our fitness coach is ready to get our hearts racing. I hope you are ready. But before then, Mythbusters.
This was a really good one.
Yeah. Yes. Yeah.
The animation was just
On
spot
point.
on.
Yes. I like the eyebrow thing. Like, let's not say.
I do you know that?
Yes.
People have terms.
I like that. I like that. It's important to have terms. But oral sex, does it cause cancer?
To say this is totally a myth will be false.
I think so too.
So generally cancer or you're multifactorial because same risk factors and we're exposed out to it, you may not necessarily develop
Yes.
cancer.
Yes. Or someone would.
Or you're being exposed to the risk factor, your body's ability to repair damaged cells, put them back on track, kill them off, or so it's multifactorial. Has there been a causal link? Has there been a causal link to oral cancers and oral sex? Yes, there's been.
It should not increase risk, causal link.
So when I say a causal link,
Yeah.
Chere, now the current evidence
Yes.
is saying that, first, most of the oral cancers are going more, the risk factors were strongly alcohol, smoking, but now, HPV, human papilloma virus infection, is increasing in the patients with oral cancers. Yes, those who smoke, those who drink, also have an even further increase their risk of developing the cancer. But that strong correlation is becoming manifest. So to say that oral sex no cause a cancer, I wouldn't say that. But can oral sex predispose you to?
Yes.
I'll say yes.
To oral cancer.
Other things you can do, yes. Watch your sexual life. Risky sexual behaviors, multiple sexual partners, because genital warts, STIs, all those things put you at increased risk of all the HPV and all that. So watch your sexual behaviors, and it should always be a discussion between, especially when we talk about married people, it should be a discussion between the two, knowing the risks and the potential benefits.
About anything you want to add?
Also, risky sexual behavior, I'll just pick up on that bit. Sometimes through no fault of yours. So you don't have a risky sexual behavior. You don't have too much of any exposure as far as these things are concerned. But the partner that you're married to, because of the exposure he or she has had, predisposes you if you engage in oral sex with this particular partner. And the thing is that, you know, the body has organisms that are in certain places that tend to be okay. So if it is found in a particular part of the body, it lives there and it's okay. That's where it's normally found. But if it tends to be relocated from that place to a new place, then it might stimulate cancer. So that's what happens when HPV, which can cause problems in the genital area.
Cervical cancer.
Yes, exactly. Exactly. Gets moved to
The mouth.
another area, the mouth, for example, and then they can predispose to cancers in that area. Risky sexual behavior, the question is who defines what risky is, you know, but I think that
one man, one bullet is not risky.
okay, so you can say what is not risky. What is risky, you know, they Obiano decided what I think is risky.
One man, one bullet, or chede, key and hole.
Tell you, one man, one bullet, na meka de. Sa we one man, one bullet, no nara we shoot baby. Oh yeah, one man, one bullet.
So inverse relationship. One man, one bullet. One man, one bullet.
One bullet. One man, one bullet.
Thank you very much.
In
That's
this
in
present
heaven.
day and age,
Oh, I think it's very possible.
I'm not saying it's not possible. It's impossible. I'm not saying it's impossible, but well, just like you said, an assessment and a talk with your partner, you know what you want to do. I would like us to meet Basiwa bi ana second is mama bi. You know, me who some describing no. Me near Fikakra. Madam Victoria or Pig Farm. For the past 2 years, no, to me that baby I was Nayase. She's barely holding on to life, and honestly, at this point, she wishes she can let go.
Yes, Babylon. Yes, Babylon.
Present day Victoria, okay. Me 52 years. Me Accra. Last 2 years November. Nti me wo hwana. Me today my idea me yo. Ti my idea me yo na me call dem. Nti me hwe na me aye period. Me say ah. Ti minim dey bia. Be mbesiafo wodin dey. Me twa na adan so sana ebe. Moko hospital na doctor kade monko scan nti moko eno na say ma wuzi ni ma ho na me ye operation
bra okọ hospital na first one no ye ka say na wo de ho ahono no ye no operation ni wie no ne 6 months na moja ni gua na etu no moja ni tu a na etu na ade ne nko me so Accra na me wo enti me kodru ho na yo say moja ni tu a na etu no na me say sa ade ande o ma me fa ne mbra Accra na me mbe hwe ne ye se de be ya metime ani akọ no ho na menya amua bi e de aboa no ya de yan wi na la to do erade wa ba ware bre papa wi amabo
Brama ya de me hye mo tun da me brida ando ye mo adukura ye de le show o rema no promoja
yensa da moja mu da mana ya wonu ne pen no so yenda menda ono so nda madenchi be ye 2 years ni yenda da
Before mama warren na wo nomba ti mukwa na makwa yes na wo nomba nti ma akaskasa ba me ne benyi ni ntimi na no me dokore
ogui na obra fie na benyi ne ja no wanhwe no wamboa no wanye ne hwe no ja no besi wodamala kapem de oso onye ne nye ba adwuma me ye nyina me jai menye adwuma menye sika kakra menya no na me da ato nda ahwe no me sika nyina sa me so nyina wodi wasika prama Sisi a yin na ya atoba ha. Bibia anyi wo ma ye dimpo sisi a lawyer din. Yesu a yegudo a Yesu no bia na ma bisa no. Wo mwa bia nkofo bu wo mwa bia enji wo bi fi bu wo mwa bia won fa mbo am na me sister no ma hwe ne ye ya ogowu obesi me nsa
Na me sister ka da yanko Vodafone. Na se ibenya mbo wa.
ti mko wo na mko suchire wo no wasa. Yo wati nti wo botum wa boam.
Yankopo ni shira hon. Na we adwuma no onyankodo. Mo bibiara obehia mbo no so. Wo ba no so wo ba fado na wa hemu no mbo.
When her sister said that they have not slept in 2 years, sometimes I'm tempted to say that slept properly in 2 years, but it's also possible that the pain and the sound of your loved one in pain, to me, do you get it? To me, I don't know whether to do, Jamaican, does it make sense to you?
Well, I think I get.
I can't undermine what she's saying,
I mean, no sleep for 2 years is
it's a lot.
Is
it possible? On day,
that's what I'm trying to say.
Or now on call to rest. Maybe that is. I think maybe we shouldn't take it too literally.
What about the one who is constantly mourning though? Caregiver, no, that's the sister. No, it makes sense when you say that. Because
for her, it can be very difficult to sleep. One in pain, if your loved one is having this amount of pain, it can be very difficult to sleep.
But the one in pain, no, is it possible, sir, she can actually be awake day and night for 2 years?
I don't think so. I mean, I'm not
Those
a
snooze
sleep
off a
expert.
little.
Yes. I mean, I don't know how you can live and still maintain sanity. I won't die for 2 years. I mean, that's
sleep. But it doesn't take away the fact that maybe you see, so pain is in levels, and generally we say that if anybody has a pain, if you're assessing pain, you ask, does it prevent you from sleeping at night? If the response is yes, or the order onyanen, ana oma on that, she struggles to sleep, moaning, sleeps off a little bit, or while you're asleep, then it wakes you up. Now there are a few things that can give you that type of pain. Generally, if you have any pain that does that, it's a red flag. It flags a clinician's mind. It gives you the extent of pain we are looking at, coupled with everything else that is going on. She looks quite, I don't know her exact age.
Yeah, she looks old.
But
it could also be the lack of sleep that's making her look that way. Hey, now one will be on that papa for some time.
You would
look older.
Because me, I'm endo.
But you're not that old, Dr. Yali.
I'm that old, but I don't sleep, so I should be looking like maybe 60.
Maybe if you're sleeping well, you look so finer than you already are.
Okay, no, I'll start sleeping. Because who doesn't want to be fine?
But Victoria, make I say almost say first instance for a surgery, Dr. Cass, surgery because Dr. Cass na bibia hu na wo de no.
No, even yes.
Or something like that, right?
Just hold on there before you go to what the doctor said.
Yes.
This is an elderly woman who saw a bleeding.
Okay.
Bleeding post-menopause is a red flag. If you're an elderly woman, you've had menopause, you're fine, then you notice bleeding, it's a red flag. Don't wait for another month to see if...
Dr. Ali, you just said we don't know her age, so let's not put menopause on her yet.
No, I'm saying, so we're putting as I'm only saying that if you're an elderly woman,
generally,
and you've hit menopause, and you see bleeding after menopause, or unusual bleeding at that age, it's a red sign, it's a red flag, and you must seek help. Don't say, oh, may trends or bokwa. Maybe the next month it won't come again. It doesn't mean it's gone.
Okay.
Do you get it? So once you see that bleeding, get an evaluation.
Make sure
wash. Hopefully at that point it will be early enough that you can have a more curative approach or more curative care.
But what do you think was that initial swelling now? Then the bleeding became worse. What do you think this is all about?
Okay, so again, usually the womb should not have any swelling. I mean, it's a nice hollow organ with a tip, usually the cervix, which is usually a solid compact organ. It should not have any out pouches or ulcerations or discolorations if it is healthy. So if there's a swelling on the womb, again, I'm assuming, as I've always maintained, in this age group of patients, then it raises a red flag, like Iyali said, and therefore would require an investigation. There is the chance that it could be something benign. Benign meaning something not a bad cancer, just a growth. But at that age, really, you want to exclude what is worrying. Usually, it won't be just a matter of removing the growth. It will have to be sampling of the growth.
Biopsy.
Yes, exactly. To see what it is. And then that informs the extent of treatment. Is it going to be radical surgery with adjunct therapy or not? Depending on what the diagnosis is that is made. So if you just go and take out the lesion, you actually probably will give.
So if you think that's what was going on, because from what the sister said, there was nothing in the statement that sounded like Dr. Neka Somumbaba. Doctor just said.
You see, another thing that my short practice has taught me is that the reported speech may not be that accurate.
Well, that's true.
Based on the understanding. That's true. Based on, you know, so what the, like Abba was saying, what the routine practice will be is that
follow-ups, isn't it?
You do biopsy.
Yeah.
It's possible that adults who KG or honum was a biopsy. It's possible. We don't have the full details.
Yes.
As per the account given. It's possible a biopsy was taken.
It was a biopsy, not necessarily a full-on surgery.
Maybe follow-up and whatever that comes.
Yeah. There are many problems associated with this condition. The bleeding is one of them. Bleeding is associated with so many problems. You are weak, you're tired, you can get into heart failure.
Even anemic.
You are
when you're anemic,
dizzy.
you can't sleep, really.
Exactly. And then you see bleeding per vaginum itself is I don't know what word to use, but a hard drain, because there's going to be persistent bleeding, foul smelling odor, the complex that comes with it, you know, the stigma that comes with it, the money that goes into requiring transfusion after transfusion after transfusion, the risk of reactions
and infections from the transfusion.
So many issues.
Potential infections from the transfusion.
Potential. Forgive
so
me.
many
Potential infections.
So many issues.
We are once again grateful to Vodafone Healthline, because we know that they would get help, or they would help us out, Victoria. We'll be right back.
So that mom can be able to open the door.
This is it.
Place it on the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got it.
Afedie, usu betumi anya kwanya sronko a ye nije ye power Vodafone so. Ye di data bundles a eni seso Ghana ha brel. Ye ma oda ye so, ye ni daso nyina bem. Enti beka ye ho, nya data mo ani je power bebre.
Vodafone, further together.
Sickle cell, Arabia, Yetidina, in Pempino, Obi Senya Bay for being at the Amawa. Ebi musu stro some beben. Obi kra se mu nyi nche. Ensempi. Banan say no. What's it? The ekoso. It's now where they are saying that there are new ways of managing sickle cell. And it's not witchcraft. It is not about being afraid to be next to the person. And you can actually live a full, fulfilling life. What do you mean? Don't worry. Dr. Sly or her and Obecheya so Kolebu Teaching Hospital. Doc, welcome.
Thank you so much.
Dianka Saye, Dr. Sylvester Mensah, my friend Dr. Sly, who's a new G.
Yeah.
Hey. But doc, my excited because sickle cell, yeah, dear. When we hear about it, I actually have a friend who has one, actually two. And when they are going through crisis now, and I was so be bang pakrono, and in your mistake, man, you cry. I say, you're crying, you stroke. What really is it? Now then, I saw more yari gidi sa. And I say, one way ya, obe free one son.
Okay.
So what really is it?
All right. The sickle cell disease, one of the genetic conditions of the blood. The say genetic condition. I try say it's something you inherit, and I say they will.
Okay.
Exactly.
Okay.
Exactly. It is obenya sickle cell disease. I try say mame ne papa no. Each of them bema one of the traits. And say when you get both of the abnormal traits, that is when we develop a sickle cell disease.
The sickle cell, moja mu yare, and I say, Junso mu yare, and I say, fifre yare, na saliva yare, or when funny be who.
Okay, into moja pneumono, your cells be a friend red blood cells.
Okay.
Now red blood cells, I be with my friend hemoglobin.
Okay.
Into nipebia or two variants. Into normal hemoglobin, your friend A hemoglobin.
It's me variants, brofono. It's me the bad type.
Okay.
It's me can say. And you're correct, but you're fan set type. Okay. And I who do me. Okay.
Into your normal one, which is A.
Okay.
And then there are
A and normal.
A and normal.
Okay.
And then your other abnormal ones. Your S. Your C.
A.
Your C. There are other ones. D, E, Edoso.
A. Alphabet no mu. Meaning now woman. Haboteo. A, B, A ni pen normal. B, C, D, E. Robert B I chose to be abnormal.
Yes.
Inte hu nya se bedwini baba.
Dabi.
Yanka ni say A normal.
Patchwork.
Ewo moja ni.
Yes.
Okay. Now so here two. Into no papa ye A. O mama ye A. Ye normal.
Nti ade ne say nipa bia wo two of the ahodo no mienu. Nti normal person only sickle cell yare no ono or AA or any mienu.
Just any papa ne mama nyina no mu ni bi kra. Ebi ni moja nim kitiwa bi kra.
It could be kra say ne mama ne papa mo their friend no traits. Nti e ka say what traits na che say wo normal ne baako and abnormal ne baako. Nti obet what genotype be say AS.
Bisa. Social media so no.
Yes.
It is bisa. Inti no say bia, enfa ne say me ye na me ni sickle cell crash. Say me papa ne mama nyina na ebia na bi kra kakra wo mu, but me nya normal ni nko a na de wo me. But me nua bi betumi nya me papa S ba ko na ne namu no. Ana C ana Q ne F double bebrebe no. Bi ene namu no. Abefra no ne mama A no. No abeye the offer ni traits. Traits no. First na me ti be say career na the same thing as
same thing as the career.
That here no ase. Okay. Inti no me busa question me say den na ma me nanfo no no so mo yare gidi and omo so mo san kofom ya gidi no say me nanfo no na ye AS no ana AC na obo bebe na say SS ne me combination team se am ya mass bebe anu bia na yutumi na SC ana.
Oh yes, the
questions no dos
combination dey betumi about a whole lot bebe.
Okay.
Until usually say parents no more your careers say na work kan na.
E just say
e bia infant say papa ye AS, mama so ye AS. E just say there's a 25% chance. And I say 1 in 4. And I say 1 in 4 chance. Say mama no 5 years no akola no will be someone with the disease. That's
okay. Okay. And also chere say 1 in 4 now kind. I just say or one 4th born e benya na.
Oh that be. I just say anytime a woman befa yefuno no, there's a 1 in 4 chance. Until betumi awo 4, they could all be SS.
Hey. Even though we career.
Yes. And until now usually when mama and papa no have the traits, we usually advise say it's not a good match.
Trait tipo.
Yes.
So good our baby. Into share be wan say be wan SS ana. Yes ana. It's a vibe no kuno.
But it's a good thing. You have to know. It's a good thing to know. Until early on in the relationship, these are the things I some discuss early on.
Intenya be
that be enya be.
Enye obi no wa to aduro bi.
There be.
Anya saye de wo.
Ye de wo.
And then yakopon dia mind dada. Na obi wo ka SS no, obi wo SC na, omo so mtumi yare sa.
Yes. So SS no na your friend is sickle cell anemia. Because omo na usually they have the most severe form of the condition. But SC, you know, so you have sickle cell disease. But also they can also get
yarisa.
To me yarisa.
Yare ninti anankofo ebre suro so beka akọ obi a wo SS no ho ana SC no ho. First na me nyin no po no. Na be feel say to me signs na HIV sign is anyoma no. Etisa na stigma na around sickle cell phone sa na.
Ade a say nkofo hu ni say sickle cell yare no enye ade a infection. I'll be to me nya fi obi ho.
Okay.
Say na ye de won nti. So obi was sickle cell yare ni bia. A normal person say me no. Okay. The only thing is hemoglobin na one moje mu no and they abnormal. But nipa ne de a normal person just like.
Okay, normal person. Ubeka so boa dogs like. When him dentia. Almost say who person so be sickle cell where they almost say a trick. Obi o tian bia o di sounds so to me nya kese. Ono a.
O yampa.
Sa?
Your oba your clinic your clients they be wo ho a. Who no cry who say or yare ni bi. I just want to catch you. They look normal.
Nti emfa ho so bi atian obi e kese o. Ye enye hwe anim ne bi. E mojam ne hwe. Ane doctor de akire. Afa so no na minyin no ho. Na eta kasa obi wo sickle cell on di 5 years kran. So kasa ba clinic. Ada wo hwe nkwala clinic so ana se mpanyifo so tumi nya. Wo me nafo no de mem kasa me miracles. Because now you so nim say di 5 years but wa hwe rent we na me se me namfo a. Omo kuseti ase yakopon adomunti. Is it bibi stronku na omumu nti na omutumi nyin chair saa no ana say saa de no so nya no kre about say omu short life span.
Okay, in the past no na healthcare enko enim sa.
Okay.
Nti na care na yedema omo sickle cell yare no na enhye dan ko enim. But sisi ade advances aba.
Sir?
Care no and there are new things aba. There are other things yede aka ho. Nti ama they are able to live a normal fulfilling life.
Yanka ho asem ya ho no bo ho ma me checheasi then na first mo ya na enko yi ana nse mo different na yen friend the current trends since e pe headline current trends pachochiasi yi ni ehu how won share yen kran yen ne na obi enso pi.
Okay. Nti first na man for ta Emba hospital.
Okay, that's number
because
one.
Because of the thoughts in say sickle cell no is due to witchcraft ni ade. Nti ebi anipa ne kranya the friend of crisis na.
O yare na.
Omo fa Emba hospital. Okay. Nti that was part of the reasons why na lifespan no is not.
Okay. Nti no masesa no.
Sisi ade education akweni. Okay. Education akweni. And now you screening at the newborn level. Nti ye wo akola no odi best 6 months ekona na ya check.
Okay.
They sometimes you to me check it earlier than 6 months.
Nti no free at night ya.
For the newborn screen, I think that one is subsidized.
Like a hospital bill now. But anya kese sa. Na mpanyifo de so e.
Mpanyifo de no de oba ye clinic honoma ye betumi ayama. It's a walk-in clinic. You can just walk in that open say your test no ye be yama.
Nti management na monya na nse na ama life expectancy ekoye no. Is it only about prevention because two no are mentioning na na preventive. And am was some treatments be asesa na say bibi
okay. So even with the prevention no omo what sickle cell yare no they know anyama trigger omo crisis.
Oh sir,
they know anyama.
Opacho bobi sumai.
Nti e be a dehydration. Just say nipa no enta no mensuo na ne body ni mu ye dry a no betimi akose mana enya crisis.
Insuo ye draw.
Yeah.
Insuo. Insuo.
Another thing is your infection. Usually we educate them to keep a good personal hygiene and then avoid any amebema we will call for infections near
nti onware yie onyi na motuo mu yie
behwe ne didie mu
akosu akuma mu nyina anya ne kama hwe ho so yie onto ne mpa
exactly
onprapra ne dem ni nyina aka ho ni nyina aka current trends na mo chechro mo no
nyina aka and then the next thing they say sometimes extremes of emotion to and also to make trigger crisis.
Oh, dog jaisa.
Nti se nipa
dog slime pesa. Adwin so aye adwin nipa de say how drink kakra na drink kakra ja wo hwe ne how far na so to me ma
and so to me
a trigger
crisis. Nti usually psychosocial management. Nti me ka say psychosocial management nse sickle cell yare no enye say nipa no or disease na nkwa na ye hwe no the busuafo and the community at large so account you educate community no and then the family now they are able to support these people better until a mass stigmatization about from Emma care na omunya wo fie ni ade ni ani akosro. And it all improves their
life expectancy.
Yes, their life expectancy.
Nti no se na wo ka adwumedwin says and make make stress. It may trigger crisis.
Yes, stress. Nti your patients no obi anim how much stress they can handle.
Okay. Nti so study ho. Ba kwala ni sha se na ka se mu screen sa kwala no be don stress do ba betumi handle.
Yes. Nti nkwala no usually when they get crisis, there are common things that you can see.
Like
Ebia they get swelling, ebia obi say nsa hono ana ne nan hono. Those are the common things that in kolaninya. Unlike adults no, because in kolani ebi o ha ontumi nkasa.
Okay.
Ontumi nkasa.
And no dey no cry.
To
be hwesa na aposo. Ehunhun kakra ne sa nyoma na. Osu awanye ye.
Uso ni baby ana I say.
No. Doc, indro fufura ba na.
Oh yes. Indro system no. Nti there are some they've not yet been approved for use here in Ghana.
Oh. Ade. Yes,
because
bureaucracy and answer.
Oh no, once before I ever approve a drone, I say yeah clinical trials.
Oh Ghana. Yeah, clinical trials for Ghana.
It's because of CCR.
Oh wow.
Because yeah institute.
Oh wow. Congratulations.
Thank you so much. Yeah, per se making sure say the drugs are safe for our people.
Okay.
And that I mean, it will help our people before you inculcate.
But you have a few different ones for Fraba.
Oh yes, they've been approved already, which are currently used. One common one is hydroxyurea.
First name ho. See a wo. In kwalanke to anisu to me fa.
Nkwalani ni atu.
Obia to me fa.
In fact, ebwa nkwala no kra, the earlier you start it, the better.
Nti se na wo kan de current trend e betumi aka say e bedru baby no sickle cell eto betwa na cure beba.
Oh, we are hopeful about that. We are hopeful about it. That's what we are all aiming for.
But you see, and the drone Maya to me cure, because I was hoping saying, overcome bisa.
In drone, no, your friend no disease modifying drugs. They can say disease modifying. I just say it doesn't cure the condition.
Yes.
But what it does is that it makes the condition more manageable, and I say it makes it easier to live with the condition because it reduces incidence of crisis now.
Okay. Okay. Until the longer we go throughout the fewer times when you crisis and now we yari gidi as a sickle cell person, the better our quality of life. You bet me I can say.
Exactly. Because what I yari how we do ma. Say we go school how school. Yeah, it really help.
Okay, infection be meeting. Until malaria so to me ma omunya crisis.
Oh yes. Because malaria na dey
Kata.
Yes.
Is there a listing of
any infection you can think of. Any infection you can think of. And then for the drugs, I want to mention a few things about the drugs.
Yes,
for the hydroxyurea, I know what it does that it increases. There's another variant, another type of hemoglobin, a friend fetal hemoglobin, and I say hemoglobin F. I know you will be. And until now, even if the child has sickle cell disease, from birth up to about 6 months, maybe only symptoms because our fetal hemoglobin was system no be brave. Until one mechanism of hydroxyurea neboa, they say increases our fetal hemoglobin. Until patients are first now they used to get a lot of crisis in a year. No, CCR they are getting less.
I am one Doctor's line.
They are getting less.
Oh, that's good.
It's really helping.
That's really good. But is there a take-home message for us?
Yes. So sickle cell disease is more common here in sub-Saharan Africa.
How come?
Yes.
Now that's another topic for another day.
Yes, but statistics in nature say about 2% of all babies born every year have the condition.
In Ghana?
Here in Ghana, yes. About 2%. It's quite a common condition.
2%. But in Swasa?
In Swasa.
We need 100, for 2. And 100 and for 2.
Yes.
Now, hospital back that means every night be at least about sickle cell.
That's true. Until care has improved. Until no one say we need sickle cell. Just note that the person is a normal human being, like I said, just like you. Just has abnormal hemoglobin. Until no one say you support the person emotionally and in any way that you can. And more condition so area. That's not the time to sit at home and self-medicate. Just get to the nearest health facility. Say, almost sure on us, they'll refer you to the specialist facility, and then they're always there to take care of you.
Dr. Sai, catch me, yeah, boy and come on, say specialist facility in your Kolobu Press. See a G, Kumasi G, almost Sapa Pepper. Into Mama Yensu. Mama Yensu, Mama Yen, fan you may be to share, maybe I make us may training power. No, I put you, Yami Frema, Yami. Doc.
So that mom can be able to open the door.
This is it.
Please open the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Afedie, usu betumi anya kwanya sronko a ye nije ye power Vodafone so. Ye the data bundles are any seso Ghana ha bro. Ye ma da ye so, ye ni da so nyina bem. Enti beka ye ho, nya data mo ani je power bebre.
Vodafone, further together.
Madam Victoria Ekeke was referred to us from Ahmadiyya Muslim Mission Hospital. She had initially been to Efia Kwanta Hospital, where she was being investigated for what was causing her to bleed. Unfortunately, she defaulted and reported later when symptoms had become more severe. So at the referral hospital, a biopsy, an endometrial biopsy was done, which showed we were dealing with an invasive viloglandular adenocarcinoma of the uterus. In Kolebu, further studies were done which revealed that the malignancy had indeed spread beyond the uterus and had invaded the bladder, had invaded the rectum, and had gone outside the pelvis. And due to the advanced nature of the condition, it was deemed that surgery won't be the best option for her at the tumor board. So currently, she's been referred to the radio oncology unit for further management.
Welcome to today's episode. And next, you're about to work on your shoulders and your cheek. Sometimes, now your cheek or shot, I know we cheer foldy. It's exercise here, baby. And I'm boy, not fast in the way your chin or swat. Now you see dumbbells. It's only dumbbells, for bottle. Never sand, and I'm not see a good name. Bottle, you see the old bit me. Maybe I catch one like I said, you'll bet me the annual. So we start with this. 2, 3, 4, 5. So we come back in position. Here I'll call your side. Pitch now straight. Chest out. There you go. 1, 2, 3, 4, 5. Here. So now switching our back in position. But when the question you say. Then you take it out. 1, 2, 3, 4, 5. We have a backward two. Now other leg no. Bako when you say kakra. Neko when you kakra slightly lean forward, chest out, and then you go. As you are taking it, take it below your knee. Then you bring it up. 5, 4, 3, 2, 1. We are no abba. So as you put our bottle in one. No walk from say. 1, 2. What's a make for me? Show pen and me. Don't do this. And yes, I won't feel the effect, you know. Go down like this. 1, 2, 3, 4, 5. Take it to the other hand. Same thing. 1, 2, 3, 4, 5. After funny me, Nation hobium. Slightly bend forward. For when you go in, then you bring it back. Making sure that you are stretching your back as you're doing it. 1, 2, 3, 4, 5. I hope you had fun this week. Cause one day your main jai. See you next time.
Today in This Week in Medicine, we talk about pioneering medical education in Ghana. We drop the spotlight on the University of Ghana Medical School, my alma mater. In 1919, when Sir Frederick Gordon Gudgesby, the then governor of the Gold Coast, built the Kolebu Teaching Hospital, the idea to build a medical school was birthed. Unfortunately, due to many reasons, this was suspended until 1951 upon a visit of a delegation from the University College of the Gold Coast. The medical school was finally planned to take off, training about 20-25 students per year and converting the Kolebu Teaching Hospital to the intended teaching hospital. In 1962, was the first batch matriculated to pursue a Bachelor of Medical Sciences. They eventually graduated in 1969 after 7 years. 39 gallant Ghanaians graduated as doctors. The University of Ghana has since produced illustrious sons and daughters that have pushed the frontiers of medicine in Ghana. In 1974, the dental school was initiated, but it was not until 1992 that the dental school became fully localized to train dentists from beginning to end, and graduated the first batch of dentists. In 1998, the School of Allied Health Sciences followed suit and initiated the training of other medical professionals, including physiotherapists, radiologists, medical laboratory scientists, and many others. The various professionals trained have worked tirelessly to maintain the status quo of health in Ghana. Kudos to all health professionals, to all you young and intelligent ones out there with dreams of being a medical doctor, a medical laboratory scientist, or any allied health practitioner. Keep working hard, stay focused. I hope that you realize your dream soon. And that's me can yede. Nkomo nya ko suapon a oche nkofo style obe doctors, lab technicians, physiotherapists. Na yekai ye governor ko Sir Gordon Gudgesby. Nam no do Kolebu Teaching Hospital obey. Na di kamfo wo ba ya wo bo ma University of Ghana Medical School or established, and since then doctors pia we produce awa aboa ma Ghana fo we nya pomzin. Na me the dama opportunity me encourage mbofamba ye nananom yemba wo sua za opede we doctors ana radiotherapists ana with laboratory scientists ana physiotherapists ana radiologists wombo modern wonsuade mo onyunti mo mbuku na dachi mo dream of a reality. Thank you. This is all we have for this week in medicine.
Welcome to Duels in the Kitchen with me, Firma. Today we are talking about Quintia. Quintia, in the Nigerians use Ghana for use. Make sure say a lot of West African countries have it in their own right. And it's a very, very good spice. It's a natural spice. It comes in the form of a pod. Actually, it looks like a finger. And Quintia is anti-inflammatory. As usual, when you take anything that's anti-inflammatory, my body needs to be healed. And wintia is actually well known to help ease symptoms of stomach ulcer. And wintia so a food preservative. Yes. So what to beef you just the ones that the demo. Uka kokoma banana and say and tell a wintia now the 2 minutes in air buano. Wintia so buama emanya regular menstrual flow. It's a good thing. It's actually a good thing, but so for your phone, be careful because when you have a brain, so at that point, you need to say, missing. I say, aqualano, but what aqualana over problems with brain. So you have to be careful with when you're expecting. I did back one time when you and said, what kata and I said, oh, but one kitchen kitty beer and I said, was some flu beer. And yet they only had doctor phone, kitchen kitty big smart. And by time be bound per se, how I finish on your manner. What they went to be to show me now I want. I tell you, Humbertos is here. My word never was. Well, that's my way of putting it. You know, you self-help. Self-help. That's what Jewels in the Kitchen is all about.
Absolutely.
Highlights?
Well, I think that we talked about sickle cell disease, sickle cell anemia, actually, and it's good to create awareness about it. I mean, and the awareness is not only for when the patient has been born already and diagnosed, but even premarital counseling. Frema ukakowani akacho say uknu ye AS now also ye AS.
As the awareness is almost there.
The question is that doctor's life
last you go marry.
So some of these things are very difficult, but they are very real problems because as you're in love at that time, you won't be feeling that way when you have a child who is constantly getting sick. But moving on, if it has already occurred, then you must understand the disease that we are dealing with and all the little things that you must do to help maintain the quality of life of the patient.
Yeah.
So.
I think like I so assuredly said. So at that point now, we set wedding date, we start counseling, which is the time most people begin to do these tests.
Yes, actually.
Invariably, only a few people would they postpone. I've had several people coming to talk to me about it, and then they end up going forward with the marriage. So what do? Let's test early before you take your relationship to the next, your courtship to the next level. Test early so that you can advise yourself. If it's something you can't do without, then you're able to amicably, go your separate ways. I'd like to round up with what was it?
Oral sex.
Yes.
I knew you want to talk about.
I would like to round up with risky sexual behavior. Yes. And aside the risk of cancer, like I said, cancer is multifactorial. There are things that could predispose or not. There are other things that risky sexual behaviors can give you. STIs, for the woman, infertility, HIV/AIDS, and its concomitant issues. So let's try and keep a very worthy, sane, sacred sexual behavior. And hopefully, we'll reduce the risk of all this.
If you are not sure what a risky sexual behavior is and you think you are not going in depth enough for you, just call 255. I am sure there's a doctor there waiting to tell you all about that and how you can protect yourself. Thank you for joining us. It's been educative, it's been inspirational, it's been enjoyable. Catch you later.
Vodafone, further together.